7e conférence de l'Institut d'analyse stratégique et d'innovation du CUSM. Alors, j'espère que vous êtes tous de bonne humeur ce matin, plein de vigueur, in order to address a subject that I think is just fantastic for the MUHC, because it's a subject that concerns the patient directly. And this is our mission in life, and I think to be able to have a day to think about how do we involve our patients, how we create a partnership with them, how do we get engaged into what we do. I think it's a just unbelievable opportunity. And I think we have to learn a lot from the discussion that are going to be happening today. I'd like to say that there are some people in the rooms that for me are quite important. I see members of my boards that are sitting not too far away. And I would like to say that it's on my part and on the MUHC board of governance of the MUHC that I would like to wish you welcome. I'd like to also mention that we also have the CEO, Bill Tall, and president of Healthcare Can, which is the new organization that got together for representing all academic health science center in Canada. So thank you very much. Pleasant to have you here. And we are particularly happy to welcome our partners from the Canadian Foundation for Healthcare Improvement, as well as our distinguished guests from all over the world, because yes, there are people that come from not only Canada but other countries, and it's always nice at the MUHC to receive and to be the host of people that comes and brings us their learning from where they were. So I think this is going to be extraordinary. At the MUHC, we decided several years ago to place patients at the heart of care, foster their engagement, their contribution to healing and wellness. These values are more than words on a mission statement. They are intrinsic to the daily activities of the men and women of the MUHC. I believe that I wish to thank the organizing committee as well as the conference planning committee for a program which I'm sure you're going to find fantastic during the course of the day. And very often we forget that these, when we say committees, there are people involved. I'd like to mention one person who for me is quite important, Patty O'Connor, who's right in front of me. Patty decided at one point that she wanted to step down from the role of Director of Nursing. I went on my knees. I said, Patty, I need your help. You can't go right now. I need to really make sure that all your talent are going to be brought to contribution in order to really do something for patients. And let me say that I didn't stay too long on my knees. She's an incredible person. I thank you very much for having accepted to get the right words about our patients and to take that cause for the next, hopefully, few years. And it's, I always said, probably if I've been, it doesn't show because I look quite young, but I've been 35 years in healthcare. And one of my long experience in healthcare was to be Director of Human Resources within the hospitals of McGill. And I've learned that if you really want to get something done, make sure that the people around you take the cause, and then it's going to work. So then consequently, it's a lot of humility that I say that the people who have decided to organize this event of today, they're the important people, and I certainly want to thank them because I think it's fantastic. We will have the opportunity to learn from the best and how to engage patient, the impact of such partnership on organizational culture, on the quality of care, and the performance. And performance has become extremely important, but as I've said many, many times, we want to make sure that performance doesn't impede on the quality and the safety for our patient. I've been saying in a major transformation and turnaround of the MUHC over the last 2 years that in fact, there is a way of being able to take care, give better services, make sure that we have great quality of care. and at the same time adopt best practice that ensure us to have performance results that are within the guidelines of what we are mandated. I think hospitals have lived too long on credit cards, but I think at the same time hospitals needs to be extremely focused on the patients, and when you speak with patients, basically you get much better result because by being partners in their care, they become extremely important in ensuring also that hospitals don't spend for reasons that are inappropriate. At the MUHC, we are in the midst of the most significant transformation of our history. Patient experience will certainly change, but our commitment to quality and patient-centric care will remain. We will be presenting some case studies from the MUHC, and we are proud to say that the TCAB, which is the transfer care to the bedside, and the experience that we have had with My Toolbox are two examples that will be presented that really show what kind of impact you have when you do bring the contributions of patient. And the insight of others on how best to engage patients, yes, but more importantly, to ensure that such initiatives are sustainable over time in order to achieve the best possible outcomes. Finally, because such conferences are not possible unless you have distinguished speakers, I'd like to certainly say thank you for the ones that have accepted, and I've met them last night at a dinner, and I think we have a fantastic group who are coming. And it would not be possible unless we would have the generous contribution of some of our sponsors, and I would like to recognize Rush, who was there last night, and I think they've always been extremely helpful. I don't know whether the people and the representative of Rush are here this morning, but they're far distance in the back. Thank you very much for being with us. The McGill Nursing Collaborative, I think there's a great support from some foundations in regard to this to support the McGill Nursing Collaborative, and I thank them immensely for their contributions. CFHI, CGI, Boehringer Egelman, Jewish General Hospital, who's decided to also contribute, IMS Brogan, and Healthcare Can, which I've mentioned the CEO is with us this morning. So I wish you a great conference. Je vous souhaite une excellente conférence. And in order to start, I would like to invite Dr. Ross Baker to come forward while I introduce him. We can give him a hand of applause. Even if I haven't given you anything, I think it's good to have him around. I've met him last night. I was able to sit beside him, and he was able to talk to me about some of the great thing he did. And it was with Dr. Peter Norton at the University of Calgary that Dr. Ross Baker led the landmark Canadian Adverse Event Study published in 2004. He will, I'm sure, speak a few words about it, but I think it had a major impact on Canadian habits, behaviors about identifying what cause difficult events in the life of patients in hospital. The study sets of alarm bell across the country about the safety and quality of our healthcare. He recommended the creation of the Canadian Patient Safety Institute, and he has helped lead the Safer Healthcare Now campaign focused on widespread implementation of concrete improvement in patient safety. His book, High Performing Healthcare System, Delivering Quality by Design, which was published in 2008, analyzed 7 healthcare systems that have successfully used quality improvement tools and acknowledge management strategy to transform their health delivery systems. Dr. Baker's work over more than a decade demonstrates that patient engagement is a significant component of effective quality and safety improvement initiative. Dr. Baker's most recent research examined the impact of partnering with patients on the design, delivery, and evaluation of health services. Please, again, welcome Ross Baker to this podium.